In 1951, a Canadian railroad worker named Harrison Ford walked into a hospital with a strange complaint. His skin had a permanent blue tint. Doctors were baffled. This wasn't a trick of the light. His blood, when drawn, was a deep chocolate brown instead of bright red. The diagnosis was methyloglobinemia, a rare condition where blood cannot properly carry oxygen. It should have been a death sentence. Yet Harrison felt perfectly fine. He was strong, healthy, and worked a demanding physical job. How was this possible? The answer lay in a genetic mutation he was born with. His body had adapted to function with less oxygen in his blood. Doctors realized his blood held a secret. It was extraordinarily resistant to changes in oxygen levels and certain poisons. This discovery caught the attention of Dr. Leland Clark, a biochemist working on a monumental problem: open heart surgery. At the time, surgery on a still heart was impossible. Machines to oxygenate blood outside the body were dangerously crude. The machines created bubbles in the blood, causing fatal air embolisms when returned to the patient. It was a deadly roadblock. Dr. Clark had a radical idea. What if they used a special substance that could safely trap and eliminate those bubbles? He needed a surfactant, a soap-like molecule, and he found it in the blood of the man who was blue. A protein in Harrison's unique blood was a powerful natural anti-foaming agent. It could make bubble oxygenators safe. Harrison became a regular blood donor. For years, he gave his rare blue blood so its properties could be studied and replicated. Researchers purified the key protein. They learned to synthesize it, creating a drug called Polyxamer 188, or the blue man's gift. This drug was added to early heart-lung machines. Suddenly, open heart surgery became a viable, life-saving procedure. Millions of lives were saved. Bypass surgeries, valve replacements, and heart transplants all relied on this technology. But the story doesn't end there. The anti-foaming agent found other critical uses, like treating premature babies. Infants with underdeveloped lungs often need ventilators, which can damage their lungs. The surfactant protects them. Today, synthetic surfactants based on that original discovery are standard treatment, saving countless newborns every year. Harrison Ford lived a full life, largely unaware of the global impact of his condition. He passed away in 1993. He never sought fame or fortune. He was simply a man who answered the call when science needed him. His legacy is measured in heartbeats, the steady rhythm of millions of hearts repaired because of his unique biology. It's a profound reminder that medical miracles often come from the most unexpected places and from the generosity of ordinary people. So the next time you hear of a medical breakthrough, remember the railroad worker whose blood turned blue. His life, a quirk of nature, became a gift to humanity, proving that within our differences often lie the seeds of salvation.